The periodontal endoscopy system consists of several components attached to a cart: a camera LED controller, a fiber optic endoscope, a monitor, a single-use sterile sheath, dental instruments called explorers, and a water delivery device. The periodontal endoscopy system utilizes a CCD camera and LED light source optimized through a controller for real-time video imaging. The 120 lumen LED light source has a lifespan of 30,000 hours. System output options include S-video, composite video, and USB 2.0. The endoscope fiber is a reusable 1 millimeter diameter, 1 meter long, flexible fiber optic probe with both imaging and illumination capabilities. This fiber optic probe provides magnifications from 20 to 40x and a view of up to 3 millimeters wide. The periodontal endoscopy sheath eliminates the need to sterilize the fiber, which significantly extends the life of the fiber and is designed to deliver water irrigation to keep the endoscope lens clear. The spring action locking mechanism on the fiber creates a tight, secure adaptation of sheath window and fiber lens for clear in-focus images. The periodontal endoscopy explorers are sterilizable dental instruments that hold the sheath fiber complex, allowing for intraoral use. The water delivery device keeps the field clear of blood and debris, connects to a standard in-office air line, and operates by a pedal through an air-operated valve. The 17-inch medical-grade monitor provides high-definition, real-time video imaging from the endoscopic system. The resolution is 1280 by 1024, running on 24-volt DC transformed from AC 100 to 200 volts, and has inputs of S-video, digital, VGA, and CBVS. The 5-wheel base provides a sturdy platform and easy transport from room to room using the attached handle. Wheel locks reduce unwanted movement of the system, and the power cord extends to at least 6 feet. The Fiber Sheath Explorer Complex, or camera, for use in endoscopic periodontal debridement. After the flexible endoscope is attached to the cart, the protective sleeve is removed and the fiber carefully inserted into a sterile, single-use sheath. When coupled together, the fiber spring mechanism mates the fiber lens to the sheath lens to maintain clear, in-focus imaging. The water tubing is attached, and utilizing the pedal-controlled water delivery device, clear subgingival viewing is maximized. The sheath is then attached to one of 4 explorers for subgingival endoscopic debridement. For more information on explorer positioning, seek manufacturer's educational information. This video image is of Abraham Lincoln's left eye on the U.S. $5 bill. The imaging is with a free fiber without a sheath or explorer attached. Here we're looking up close at a plastic tooth model or typodont. There's some simulated calculus painted on the roots, and now we're looking at the inside of the furcation of the upper molar. Here you can see the fiber sheath explorer complex placed subgingivally along with an ultrasonic instrument. These explorers have a shield extending past the end of the endoscope camera lens to allow for a visual space to see the root for debridement. This is an endoscopic view of a root fracture stained with disclosing solution. You can see the shield at the top of the screen, the soft tissue on the sides, and the root fracture stained with the disclosing solution. The endoscope is a 1 millimeter diameter flexible camera that fits into a sterile sheath that fits into an explorer. At the very end of the explorer is a shield, and you can see the shield attached to the camera that's poking into the soft tissue margin. I'll be showing this 3 different times. So what you're seeing right now is the cement, and you can see that there's this big white thing that's moving. That's the cement that we're removing. Again, we're approaching the sulcus. There's some bleeding there, and we get past the bleeding and into the sulcus, and there in the center you see that cement. You also see the crown margin, the metal crown margin, and to the left the crown, the implant crown. You can see that there's a little cavitation bubble, and the cement is being removed by an ultrasonic instrument. So again, we're approaching the sulcus, going into the sulcus. There's a little bleeding there. It's flushed out by water, and you can see the cement is exposed. There again is a crown margin. You can see the gingival margin again. As we push the camera into the sulcus, you can see the cement. It's a pretty large piece of cement, and we're dislodging that cement with an ultrasonic instrument. The primary use for the periodontal endoscope is for subgingival calculus removal. This is done utilizing ultrasonic instruments, in this case magnetostrictive, using a probe-like insert. Typically black or brown calculus appears yellow or white under the bright fiber optic light. You can see the shield over to the right, and now the root is endoscopically cleaned. The periodontal endoscope changes the fundamental aspect of visual access. This is a non-surgical, minimally invasive treatment for periodontal disease. It requires the coordination of patient, operator, and equipment positioning. Observe camera and ultrasonic positioning, then sitting upright to view instruments subgingivally on the monitor. Basic ergonomics requires that all instruments be within reach, and for this technique a minimal number of ultrasonic instruments are required. The majority of the endoscopic debridement can be done with a standard probe-like ultrasonic instrument. It takes practice to coordinate hands, looking at a monitor, and also using your feet to control both ultrasonic and endoscopic water irrigation. Periodontal endoscopy does not require an assistant. It does require comfortable operator positioning, local anesthesia, effective patient and water evacuation positioning, and most of all, practice and patience.